Hey fam, welcome or welcome back to Muse and Be Well. We are so glad that you're here. For anyone new, I am Taelor Chanel, a visual creative and a certified sound healer.
And I'm Misha, Battiste, a certified life and leadership coach. And this is your space for dreamers learning to live well. Guess what, y'all? Today is our season finale. This is episode 8. How you feeling about that, Taelor?
I feel bittersweet. Like, we made it to season 2, the end of season 2.
Yeah, 18 episodes, I think. 16
I think
maybe.
so.
16.
I think 16.
16.
But then we brought guests this season, so
we did.
And we got another one here today.
We do.
But today's episode is one I think our community needs. We're going to be talking about mental health in a real, honest, uncomfortable, but necessary way, because there are so many of us, I feel like, are struggling and don't even know it, or may know it, but don't feel like we can say it out loud or know the right steps to take.
Yeah, there's real reasons for that, like cultural stigma, medical mistrust, access barriers. You know, this system was not created with us as melanin folks in mind. So I'm glad that we have a guest today that has dedicated his career to this, to changing this stigma. And I am so ready to ask him a lot of questions.
Excellent.
Yes. So I had the pleasure of meeting our guest during my travels to Ghana a couple years ago at an event, and we connected on our passion for mental health. His name is Dr. Bryan Sackey. He is a psychopharmacologist, and we're going to let him explain what that means a little bit later on. But in short, he is a psychiatric pharmacist, a health innovator, and entrepreneur, originally from the motherland, Ghana more specifically, but set roots in DC at the age of 5. Dr. Sackey completed his undergraduate degree at the University of Maryland, College Park, and then went on to earn his Doctor of Pharmacy degree from Howard University. I know that's right, Bison. He completed 2 years of postgraduate residency with a specialization in psychiatric pharmacy and has since managed the care of thousands of individuals living with conditions like major depressive disorder, bipolar disorder, and schizophrenia spectrum disorders. But what sets him apart is what he's built beyond the clinic. Dr. Sackey is the founder of Mental Keys, a digital mental wellness platform designed to help people build resilience and improve their mental health through lifestyle-based tools, behavioral insights, and culturally sensitive coaching. He's also contributed to global health equity efforts and has built initiatives that are actively developing the next generation of healthcare leaders in minority communities. His work has been recognized nationally and internationally. I know that's right, including the Black Health Connect 40 Under 40 Clinician Award, a Howard University Distinguished Alumni Award, and features in publications both here and abroad. So, Muse and Be Well fam, please help us in welcoming Dr. Bryan Sackey, y'all.
Always busy. Go ahead, Dr. B.
How y'all doing? I am blessed and honored to be here. This is an amazing platform. I wish you guys can see kind of like just the setup that you guys, these two ladies have been able to put together. Very impressed. I feel very at home, very welcoming, so I appreciate y'all and I feel welcome in this space.
Good.
We are truly glad to have
that.
you and honored. Yeah.
Yes.
Thank you.
I'm excited for the conversation.
Yes.
Yes.
But first,
we'll get real. We'll get real with this.
We will get real.
There you go.
Well, Dr. B, you don't know this, but I have ADHD. So, and I just got diagnosed with it. So I'm interested. I'm one of the people that I guess you would serve, I guess is the way to put it. So anyway,
congrats.
Thank you. It is a congrats. It is because it's
actually like you're learning more about yourself and you're giving yourself an opportunity to unlock, an opportunity to like pretty much live a life that has a little bit more answers versus I don't know why I'm doing this. I don't know why this is happening. I don't know why it's harder for me to, go through these things, right? What's wrong with me? There's nothing wrong with you. It's you're dealing with certain things that is a part of you, but it's treatable and it's manageable. So congrats on this journey.
Don't make me cry. Don't make me cry. Okay. But thank you.
Of course.
I needed to hear that. I needed to hear that. Thank you so much. So we're gonna jump into our Muse moment. Taylor, what you got?
So, my muse moment for this episode is the lovely Alexandria L, also known as Alex L. She recently launched a book called The
Ooh,
Company We Keep. I went to her book event on Monday here in Atlanta, and the conversation was just so fruitful. If you don't know about Alex L, I found out about her years ago when she was posting pictures of a post-it note, but with like quotes on it. But now she's written 3 books. But I'm gonna drop some gems that I learned from, well, not say learned, but good reminders from the conversation. One was honesty isn't always whimsical. That there's a place for grace and a place for space. And an apology with changed behavior can strengthen your credibility and to
Ooh,
allow things to be undone. And I feel like those 4 nuggets just really hit home for me in this place
it's
of where
tough.
I'm at in my life.
yeah. The
I love
honesty,
that.
yeah, honesty is not always whimsy is so real for me because I have been practicing I guess you call radical honesty for a couple of years. And now I'm like, you know what? I'm gonna just stay tactful. Like instead of, prioritizing honesty, I'm gonna prioritize tact.
Mm,
So either holding it when it seems like the right thing to do in the moment, or just like, playing it a little better. I be telling on myself a lot, basically, in ways that I don't have to because I just like to be transparent and all of that. And I'm like,
yeah,
I don't know if that's how I want to move going forward. So I
yeah.
appreciate that. So my muse moment is me and you, Miss Tay,
Ooh,
because yeah, we are completing 2 seasons of our beautiful podcast. It's been a year. Thank you. It's been a
lovely.
year overall since we started with Life Being Lifin'. We started, I think it was like
Yeah.
May 21st, I think was when we did our live on Instagram with Life Be Lifin'.
Mhm.
So I just want to honor us for a second. And it's been beautiful. We've had some great conversations like the one we're about to have. I think we've explored a lot of interesting topics.
I agree.
That we both wanted to do throughout this time. And we found our voice. And yeah, there's just a lot of beauty. We've grown an audience. Like, I think that is so cool. We have 102 subscribers, and I think that is so cool. Thank you for everyone who clicked, like, subscribed. Thank you for
Yeah.
everyone who's watched. Like, it is even when it's 20 people who have watched our episodes, I'm like, I cannot believe 20 people clicked and like potentially watched an hour of us talking. So thank you guys, but thank you, Taylor, for musing with me and being well with me. And I'm just proud of us.
I'm proud of us too, Mish.
Yeah.
Oh, I'm so grateful for
Aw,
you.
That's
grateful for
beautiful.
you. Now, Mr. B, you take the stage with your muse moment.
Man, so music, first, I love that word. And I learned a little bit more about it yesterday through Taylor. But lately, I've been musing on, I came across, I was kind of reorganizing my space and I came across, one of my old favorite book by Virgil, Something's Off.
Mm,
So Virgil's one of my favorite just artists and creators. He is one from the motherland in Ghana.
I did not know that.
Yes, yes, yes. Rest in peace for his soul. But his creativity lives on. And for me, coming across this book, it actually came around. I bought this during a tough time in my life. I was really dealing with a lot of depression, anxiety, and the book was super bright, stood out. So I was like, okay, this is dope, first of all. And it
Mhm.
always catches my eye whenever I walk in my living room. And for me, just the title of it saying something's off always makes me pause and think. And it's like, well, something's off. It's an alarming thing for anybody to hear. But just like we kind of just talked about earlier, there's an opportunity to stop and reflect on what you're experiencing instead of ignoring or avoiding, your emotions or your feelings. So for me, every time I see that book, I'm giving myself an opportunity to just check to see what is off. Why am I just going through the day but not feeling like myself?
Mm,
And kind of looking at my meters and determining
mm.
what I need to do, whether I need to self-care, whether I need to just rest or watch something mindless on TV, just take care of myself. But it's a good reminder for me to just stop and pause. So that's what I've been using on lately.
I like that.
I love that.
Especially 'cause the bright color, it really does, like, stand out to you, and yeah,
Yes,
you don't even have to
for
get into it.
sure.
It's just like, let me it's like a trigger
Right.
moment. That's very cool.
Yeah, absolutely.
Thank you.
I love it. I love it. Okay, y'all. So we're going to transition into our grounding moment segment. If you have your essential oils handy, Dr. B, do you have some essential oils? If not, that's okay.
Yeah.
Hey, what's that? Is that
Wa-
oh, is that water?
Water.
Yeah,
Wow,
get
that
this going.
Okay. I'm hollering.
wow, I was about to say, is that
If you have
vinegar?
a candle nearby, you can use a candle too, if you want.
Mm, okay, okay. I won't burn this place down, but yeah, y'all got it.
Yeah, we
Okay.
trust
I'm gonna
you.
live through
Okay.
y'all. Yeah.
Yeah. All right. So, those who are listening and are watching, place a drop of essential oils in your hand, rub them together, and we're going to make a tent with our fingers over our nose and do a deep inhale and exhale. And inhale again and exhale. And inhale one more time and exhale. So, if you are driving, cooking, sitting at your desk, this is your invitation to slow down. If you are driving, please keep your eyes open. If you are not, then this is your invitation to close your eyes. We're going to just kind of settle into ourselves. If you need to, gently rotate your neck, get some kinks out, and lift your shoulders to your ears and drop them. And do it one more time. And drop them. Release the tension, unclench your jaw. And this episode, we're going to do a different breath work. So, this is a psychological sigh. So, we're going to do a double inhale and then release. So, we're going to inhale to our full capacity. And then, once you reach the top, we're just going to sneak in another quick breath. And then, we're going to release it through our mouths. Okay. All right. So, let's begin.
Oh, I got it on. Okay. Okay, no, I don't anymore.
Yo.
Okay, I'm ready.
So let's inhale to your full capacity. Once you reach the top, just sneak in another one. And exhale through your mouth. And again, inhale. Once you reach the top, inhale again. And exhale. We'll do this one more time. Inhale. Once you reach the top, sneak another one. Exhale.
It's good.
Gently settle into your body. Notice what may have transpired, may have shifted. This is your reminder that you can always return to your breath at any moment. It is FREE.
That's right.
Free. Okay. Now
Really
that
like
we are grounded, let's get into the meat and potatoes of this conversation. Something I'm so excited for. Woohoo! Okay, so we're going to give a little bit of context before we dive fully into the conversation. As I started to sit with the topic today, gathered some data, and of course, it was alarming but not surprising per usual. But more than 80% of Black Americans say that they're deeply concerned about the stigma of mental illness. And that stigma is one of the main reasons people don't seek help. And at the same time, only 37% of Black Americans with mental illness actually receive care, compared to over 50% of white Americans. And one of the things that stood out to me was it's not just about access, it's about trust, representation, what we've been taught or not taught about our own minds. So before we even dive into the meat and potatoes of it all, I kind of want to start this conversation off with learning more about you, Dr. B. So, because your story isn't a straight line, you weren't always headed towards mental health based off of some articles that I've read.
Right.
But can you take us back to the beginning? What was happening in your life that eventually brought you to the specific intersection of pharmacy and psychiatry?
Yes, yes. Okay, so some background work I see.
Yeah.
No, that's good. So I always like to say that cheesy line of, I didn't find mental health found me.
Mhm.
Being from Ghana descent and, actually being born there, our culture, we don't really talk about mental health. We don't, that's not a household discussion. It's not a dinner discussion. It's all relegated as a spiritual, demonic possession, something you have to pray away. Given that kind of background to give you guys like just a reference point of how growing up, that wasn't a conversation. And then even in the African American culture, that's not a conversation.
Mhm.
More now lately, especially people throwing around words like gaslight and narcissism. It's another conversation, but it wasn't something that I was surrounded by. So in my undergrad and Howard training, I was focused on kind of just your typical, well, not typical, but cardiology and infectious disease. Now, one little tidbit about me in undergrad and a little bit of PharmD school, I was in a band. I was the drummer for a band, and we had fun. Did a lot of tours and things like
Question.
that. Yes,
Were you a drummer at church?
I was.
Okay.
Yes, I
Alright.
was forced. I was forced to
Okay.
be a drummer at church.
Okay. I just had to
Uh,
ask. I had to ask. Go ahead.
yeah, you're good. Yeah, yeah. African churches, you're forced to
Yeah.
do something. Pick up a triangle or something. But anyways, so I was a drummer. I was in a band, and our photographer, she had bipolar disorder, and this is before I got into my graduate training and doctorate. Learning. By the way, I have my degree, so y'all don't play with me.
Okay.
Um,
We don't play over here either. Okay.
yeah, people are coming for heads these days, so I'm not messing with y'all. Uh, oh, before I got my training, right, I didn't really know too much about the mental health space, let alone bipolar. But I knew I was going into the health space, and so I would just tell her. She would always ask me about medications, and I always tell her like, do what your doctor says. Follow the directions, and I'm sure take your medications. One unfortunate evening, she took her life.
Mm.
For me, for a long time, I did not know how to process that. I don't know if I didn't play enough of a role to help her out, but it really did sort of sit as an empty space within me until I got through my residency training in Houston. And up until that point, I really didn't do anything in mental health. I was pursuing infectious disease or cardiology specialization. But then I had one rotation, inpatient psych, and it was my first real psych rotation. And I met this young guy, young black dude, and they put me. I was the one black resident, so they put me on him to evaluate him. And when I saw him, he was like probably like maybe like 22, and I just kind of put away my paperwork and my clipboard, and I just said, "Yo, how are you doing? Like, how are you feeling?"
Mm.
And I could see the expression on his face change. Like, no one has actually asked me how am I actually doing.
Mm.
And that kind of connection felt like the first time that empty space that I had uh, was filled. It was like starting to fill, right? To me, that's like a sign that God is telling me I'm where I'm supposed to be.
Yeah.
This is
Mhm.
the space I'm supposed to operate in. And that connection and just that small conversation was the pivot for me. From that point on, I was like, yeah, no, my life's work is in mental health. And it's interesting because pharmacy, so my father's a pharmacist as well. So I kind of pursue pharmacy out of familiarity, but the field itself, I think I look at it more so as an opportunity to identify whether patients need medications or not. I think sometimes we're over prescribed or over medicated.
Mm.
Sometimes there are opportunities to medicate or prescribe when they're not given. So mental health as a pharmacy as a background was kind of a gateway for me to get into mental health. Is kind of how I look at it. And as I matriculated into the space of mental health, um, I went, full dive. I got my residency, second year residency training. I got my board certification in psychiatry. Did a lot of like kind of catching up because at that point I'm like, I was not looking at this field like what is like, what does this
What
entail?
is it? Yeah.
Yeah.
And so for me, it once I got into it, I didn't feel like I was going to work. And I think that's one of the biggest signs that I tell people, anyone I mentor, a good sign that you're in the space you're supposed to be is it doesn't feel like work.
Yeah.
And it's not, and it's a lie when people are like, I'm excited to go. No, because you be
Every
tired.
day.
We're humans. Yeah, we're
Yeah.
humans. You don't have to be excited all the time about it, but it feels fulfilling. It feels like everything you do within this space. is fulfilling and it has a huge impact. So ever since that point, I dove full in and I've been very fortunate to help thousands of individuals in the VA system and then also internationally with different programs, initiatives, and then more recently with the app that I'm building. So it's been exciting. It's been an exciting journey. And that's kind of how I would say I got here today.
Brian.
Yes. I'm so proud
Yes,
of you,
yes.
Black man. You better come. You
Yes.
come on.
Thank you.
Are
Thank you.
I
Thank you.
you
love
Thank
it.
you.
I wonder how many other Black men are in your particular field. Like, are you one of
Mm.
only, or is there do you have a community?
There is a community, but that's a great point. With psychopharmacology itself, I don't know too many people, many Black men in psychopharmacology, right? Now, one of my mentors, actually two of my mentors, happen to be a Black man in psychopharmacology. And I didn't choose them. Again, this is one of those
That's
mental
gorgeous.
health kind of chose me. They're like, hey, mentor him. And they both happen to be in that space. And I still didn't want to do it. It was kind of later on. But
Mm,
within psychiatry itself, the practice, it is largely women that dominate the space. Now, Black Black individuals and Black men is a whole kind of like even filtering down more. So you don't see too many. I think it is opportunity for more Black men to hop into this space. But there are a lot of amazing Black psychiatrists and therapists who are doing amazing stuff in this
Yeah.
space. So
Yeah.
yeah,
Well, I'm glad that you're there doing
thank,
it.
thank you.
So you've had named earlier about your struggles with depression and
Hmm.
anxiety. I wonder what your own process of healing that was, even if you maybe, I don't know if you want to share, but if you
Yeah.
did meds or had to be on meds, I have
Hmm.
been on meds as well. So what was that experience like for you, and how did that shape how you show for your clients today?
Yeah. What's so interesting about that is, how they say doctors are the worst patients?
yes.
Yes.
I was like,
I've
hey,
seen it firsthand through my best friend.
my goodness. I'm sitting around like, what you mean I got mental health conditions? Like, what am I talking about? Um, you know, I think what was interesting for me, and I think a lot of mental health providers need to pay attention to that element. We're so busy treating that we feel like we have enough tools to self-regulate, right? No,
Mm,
we're patients too. We're humans too. So I always say that we are humans too, and we're subject to experiencing real human emotions and feelings. So I was going through a tough time in my life, and for me, I think what really hit me, the wall that I hit was, who am I?
Yeah.
I think I
mm,
lived a life where I was doing a lot of things for other people's validation, for people to kind of accept me, for who I think I was. And you sit back when you hit a really rough moment, you're stuck with just you and like, who are you? The concept of you can be alone, but feel lonely, right?
Mhm.
I don't think I was able to discern that, right? And I think I filled my life with a lot of different things to just make me feel whole. But for me, I had to take a real step back and analyze like what's happening in my life. Who am I? Um, why do I get to a point where I don't value my life enough, right? And it got to points of
mm,
suicide, right? And I think what's important in that space and that period for me is being accepting that something's off. Accepting, recognizing that something can be off, right?
yeah.
And there's nothing wrong with that. You can play basketball, injure your leg. That don't mean you're weak or you're incapable of, playing basketball. It's just that you're a human and you can injure yourself. And this thing called life. And so I really kind of learned, it made me a better practitioner because I was able to learn and feel kind of from the other side of things, what that looks like and empathize with that process a little bit. And so what I had to do was acknowledge and recognize that me having mental health concerns at this point does not make me any less of a human, does not make me weak of any sort. It makes me human. And it's actually strength when you're recognizing that you're not your best self.
Yeah.
So I got into therapy and they were kicking my butt. Man, they they're like,
You know?
I'm trying to spit all this like mental health knowledge. I'm spitting game with the, I'm like, yeah, because the pathways with the serotonin, I'm pretty sure my serotonin is low. You know what I mean? I gotta get my dopamine up, so I'm good. I'm good, doc. It's like, yeah, you're dealing with a lot of cognitive dissonance. I could tell. Oh, red meat. Oh, yeah, I look goofy in that
That's
office. I
hilarious.
look very goofy, but
Yeah.
it was a humbling experience,
Yes.
and I loved it. I loved it because you can learn and know so much about mental health and psychiatry, but that doesn't mean you know exactly how to apply it to yourself. A surgeon can't do surgery on themselves.
Mm.
And having
Yeah.
that introspection, but also the extrospection, essentially having somebody be able to look into you from outside perspective is critical. So no matter how much you know, how great you feel, even when your life is going well, I think it's great. It's awesome to have a therapist to just check in, right? We've developed patterns and behaviors that compound over time. And then later on, we're like, "Oh, okay, this is just me." No, you've harbored and invested in bad behaviors and toxic behaviors that has now become a part of you and is indistinguishable from who you are supposed to be.
Yeah.
So if you don't get that operated on, you can never really live the life that God intended for you. So
Woo.
it was an amazing moment for me. I thank God I went through that. I thank God literally was a breakthrough for
Yeah.
me, and it changed who I am, how I look at life, how I, you know, care for patients, and kind of just the passion for the things I care about.
Hilarious telling your therapist, "I just think my serotonin's a little low."
That's it. That was it.
She's
That
like,
was
"Okay, but what
good.
do you feel?
Yeah.
What do you feel in your body?" Okay.
Right.
Thank you for sharing that.
Yeah.
Absolutely.
Well, one, thank you for sharing your story. I think it will definitely help a lot of people, but it's helping me right now in this moment. So thank you for sharing that.
Absolutely.
But I want to also touch on your contributions to healthcare. So you've contributed to health equity efforts internationally. What have you learned from working outside of the US that's changed how you see mental health care here today in the States?
Man, mental health is I'll talk about Africa, right? Because that's where I did a lot of my international work. It is not regarded nowhere near to the degree that is healthy. Honestly, this is the thing. When I was reviewing the history of mental health in Ghana, up until I believe it was like 2020, maybe 2013, they only had like 8 facilities in the whole country, 8 mental health facilities. I think it was, I'm pretty sure it was less than 50 mental health providers, less than 25. We're talking about a country that has been kind of groomed under just pure antiquated approach to Christianity, right? And I say antiquated not to diminish at all or be blasphemous, but antiquated in a sense where it's just rule based versus forming a relationship with God.
Mhm.
And I
Mm,
think when it's rule based, that sort of prevented the opportunity to feel your feelings, right? Because it's like if you're feeling something, then that means you're not good enough. You're with faith, you don't have enough faith. God is not in you enough. So I gotta, you know what I mean, pray it away and push it away. Also, just kind of the homeless culture tells a lot about honestly mental health, how it's regarded in a country. There's a lot of studies that talks about how homelessness happens, whether you develop mental health conditions because you're homeless or you became homeless because you had mental health conditions. And so the way in which the society treats the homeless population can also give some insight as to whether mental health is even considered, right? And so what I would see a lot growing up in Ghana and just going and visiting, anytime I see someone homeless, that I can evidently see that there's something mentally not there, they kind of treat them as this zombie. Like it's like, yeah, they say Badam in Ghana and tree, which means crazy. And it's like this cast out sort of culture. So imagine if you have a family member who starts to develop, you know, say some really serious mental health conditions like schizophrenia or even bipolar, they may actually get kicked out the house or put into these almost insane asylum looking spaces that still exist today
Yeah.
where they are essentially chained up and almost honestly not beaten, but abused and preyed on until they feel okay. So
That's inhumane.
yeah, it is. And I can't
Mhm.
imagine what's happening in some of these other countries, you know? And so not to say, I mean, and I don't want to discredit the work that's been done in Ghana and other places in Africa. profound work, right? There's a lot of people who are trying to change the perception of mental health, and there's been a lot of progression. We did a mental health workshop recently with Black Health Connect and Additional Relatives Project in Ghana, and it was amazing just seeing the turn. I wouldn't expect so many people to actually come and listen to someone talk about their mental health. Granted, we have mad jollof rice and things to bring them, like, hey, come on down, we got jollof rice. But it it did enlighten the conversation that I was very proud of, and just the progression that it takes. So there's just an interwoven piece of religion that plays a role. And so kind of just looking at America, we are further along than what I've seen in some places in Africa. I think it's also kind of there's this derailment that I also see with mental health in America, where people have gotten to the point of learning about the condition and playing around with the words associated with
Mhm.
the field. It's almost like I know mental health now, and this is what's going on. I have anxiety, and don't judge me. I have anxiety, so let me be. And
It's
it's
true.
just kind of just stuck in the diagnosis
Yes.
versus progressing into the treatment.
Yes.
So for me, that's what I pride myself on. That's what I try to advocate. On my page, I do a lot of definitions of certain mental health concepts and applying it to our lives because I want us to learn about it, but also push towards healing.
Hmm.
So that's kind of sort of what I've been observing between different countries and America.
Hmm. That's so interesting. I want you to share with us, what is a psychopharmacologist? What is it that you do for someone who has no frame of reference for what it is?
Yes, yes. So as I mentioned earlier, I got my PharmD from Howard, right? And so as a pharmacist, you can go into various specialties. And that's
Mhm.
where residency comes into play and fellowships. I did 2 years of training and specialized in psychiatry. So with that indication or with that training, I was able to get a board certification in psychiatry. So that allows me to practice at the full length of my license, and essentially prescribe medications based on the signature at prescribe and evaluate and assess and treat patients at its full spectrum. Now, I work at the VA, Veterans Affairs. I'm here in Washington, D.C. And within that, my clinic, essentially, I'm managing patients mainly from the perspective of medication allotment. But for me, like I said, I got into this field because I felt like a lot of people were over medicated. I felt like medications were being thrown around too loose. They were just like, hey, you go ahead, take this. Oh, Zoloft, go ahead, have fun. And I would get a lot of patients referred from other providers that are on an amalgamation of medications that are destroying their system. And sometimes it just be like, bro, you shouldn't be taking these two. What's going on? They're like, well, I'm just hitting weed on the side just to kind of like, mellow me out. I don't like all these chemicals. So I just hit the weed and, man, I go to the herbal shop and grab me a little kava kava. I'm like, bro, those things are also destroying your system. Just because, they're not prescribed, they're also chemicals in a sense, whether it's from, closer to the ground or from a lab, they are chemicals and your body is
Mhm.
going to react to them. So as a psychopharmacologist, I have the opportunity to really evaluate what people are putting in their body when it comes to the management of their mental health. I also have the opportunity to be able to identify whether you need this medication or not, and let's refer you to this. Let's put you in this position. Let's actually put away the medications and then exercise, eat right, sleep better, And I'm making those clinical decisions not purely to give people medications, but to identify what's appropriate and what's not. So the joy I get really from my field, it's being able to talk to individuals at a vulnerable state
Hmm.
and have an opportunity to really guide them in their healing journey, whether it's with medications or without.
Hmm.
Wonder how you decide whether, like, they need medication or if they just need to eat right and exercise, because I can imagine people probably, if they're, dealing with depression, anxiety, like, it's hard for them to get to the point where they're eating right and exercising if they don't
Mhm.
have something to support them. So how do you
That's the
make that
key.
distinction? Yeah.
Excellent question. That's the key. There are what I tend to do with my patients and clients. I have I just want to know them, right? I just who are you? Let's talk,
Yeah.
right? Within those kind of conversations, you're able to get what we call mental status exam, MSE. I'm evaluating them as a whole. I'm looking at their appearance, their behaviors, the way they eyes are moving, the way they talk, how fast they're talking, their thought content, their affect.
Mm.
Those things give me a lot of clues as to what's going on mentally. Doesn't tell the full story, but it gives me a lot of clues, right? I'm also looking at the lab parameters. And that's important because certain labs can tell you what may be fixable through supplements versus medication. For example,
Mm.
those who have, if you look at their blood counts, the complete blood count, people with anemia or related issues can look like depression. It can look like depressive symptoms. Also, thyroid. Low thyroid can look like depression. Hyperthyroidism or high thyroid levels can look like mania, bipolar. So correcting some of those labs are actually pretty pivotal. I've seen that with some of my patients where I just corrected the anemia and everything's better, much better. A patient comes to me and they're like, I don't know why I'm down, why I'm sad, I don't know what's going on. I can look at their lab assessments and then manage that, and that could be a fix. However, it's not the case for everybody, obviously. So I
Mhm.
don't want to put that out there like, oh, just get your lab fixed and you're good. Nah, not the case. What I then do after that point is look at what have you tried? What are you doing? What are your coping strategies? What are your methods? If it's a lack of coping strategies and the condition is not life or death or suicidal, as probably the most critical point, or harming others or potential to harm yourself or abuse others or abuse yourself, then I have a little bit more patience with the process. If you don't have good coping strategies, let's work on that.
Mhm.
Maybe you might need something PRN or as needed, right? Not necessarily
Yeah.
all the time. You might need something as needed when you are really overworked or really stressed or overwhelmed. Sometimes we just need to target your sleep. There's a lot of studies that will point to poor sleep and the outcome of mental health conditions. Irritability, somebody who's angry all the time. Why is my man yelling at me every day? He's not sleeping. Bro is not sleeping. Get him some sleep and see what's going on.
Yeah.
Their routine, get some exercise, work out, get blood flow going through your body. So there's a lot of adjustments you can make in your day to day that can affect or improve your mental health. Now, beyond that, right? If you're like, I'm doing this, doc, I'm trying this, I've done therapy, I've done blah, blah. This is a point where you do need something to help you past that barrier, right? There's some folks where a therapist will tell you all day, go and work out, meet some friends, blah, 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 blah. Depression is heavy.
Mhm.
Depression is heavy. That is like a 30-pound, 40-pound, 50-pound weight on your head, your face, your body. And that's why people almost just sink into bed. You have some folks say, I just be bedridden. I'm like, well, you probably have depression. You might have depression. You know what I mean? Look into that. You're bedridden for a reason. You're couch riding for a reason. And when you look at how heavy it is, sometimes you can't just tell someone go for a run or go talk to somebody. They might need a little bit of a kick, a push, right?
Mhm.
And that's where medications come into play. It enables and activates the ability to really take care of yourself in the way that your therapist or a good coping strategy will be telling you to do. So yeah,
This is all just so fruitful information. Whew.
My
Sorry.
therapist was my therapist told me that, like, "You might wanna get on some medication because we going through a lot, we dealing with a lot, and so you might need a little boost to help you get through all of this." So,
hmm
that's true.
hmm
Yeah.
Yeah.
absolutely.
So I've noticed that in our community, getting help can mean so many different things, right? It's either what
hmm
we talked about earlier, praying it away, community, or therapy. And medication often sits at the bottom of that list or it gets left off entirely, which I can understand because for me, I have my own hesitancies or reservations just about taking medication. It's not the stigma part of it, it's more so what I am putting inside of my body, what these big pharma companies are doing to create these drugs, right? Fixing one problem, but then causing a whole bunch of other
hmm
stuff. Sorry, let me not
hmm
cuss. But
Passionate. Yeah.
from your perspective, where do you think the resistance to medication comes from in our community? And how do you hold space for that real fear while still advocating for the tools that might genuinely help someone?
It's completely understandable. It makes 100% sense. I always empathize with my patients when they come to my office. Like, I'll be concerned with some dude telling me put this in your body. Like, what you mean? Like, I've been building this body for years, and you're telling me to put something foreign in my body, and hoping that the outcome is, you know, safe enough for me to keep taking it and solve the problems. I get it. I understand. I too, I'm always concerned about what am I putting in my body. The reality is there are so many different things that we're putting in our bodies that we don't realize has an effect on us. It's just been more conventional or kind of normalized, right? There's certain foods that we put in
Mhm.
our bodies that are 10 times worse than some of these medications you see on TV with all those side effects. And it really comes down to education. It comes down to trust. It comes down to collaboration with your provider and being able to have honest conversations about what are your fears. I always start with that. Like, what are your biggest concerns with medications or your fears? What is the thing that you think can go terribly wrong with this? And I want to walk you through this process. I want to talk to you. I want to empathize with you. Right. And the it's understandable as well with the Black community. Right. We can talk about all the historical contexts that are associated with the unfortunate mistreatment of Black people within the healthcare space. So it's completely understandable to have that perception. What we do have to understand again is these things have been thoroughly evaluated, right, and scrutinized. In fact, a
Right.
lot of the things that we are putting in our bodies, like say from herbal shops or even smoking something, they're not tested or evaluated, right? They're not analyzed in a way to truly see how it affects your body. And I know there's a lot of kind of talk and discussions about the government and, can we trust them, big pharma and all that stuff. Big pharma is a business. Let's be very clear. They are a business, but there are regulatory bodies like the FDA, which ensures that because we know y'all a business, y'all not about to destroy patients. And I actually rotated to FDA and I saw the process is very scrutinized. They look at the medications that are brought up, like some drug company decides, hey, I have this weight loss drug. They are ensuring you have evaluated patients on this, thousands of patients on this. There's 3 phases that you have to go through, and you're constantly having to check, even after the drug is approved. There's a what we call pharmacovigilance, where people are reporting issues related to this drug from real life experiences. So they're constantly monitored and checked. And we as clinicians, we have to look at all the data and the literature, look through all the paper and be like, all right, cool, I trust this. I don't get paid to prescribe anything. I tell my patients all the time, like, I don't get paid to prescribe anything. We can do nothing if you want. But I'm looking at the barriers to where you want to get to. And like I was explained earlier, there are certain things that you may not be able to get through on your own. If you break your
Right.
leg, I can't expect you to go for a walk, go for a run, go exercise. Your leg is broken. Go get it fixed. And at that point, it's what kind of interventions do I need? And so certain things require certain interventions. And as long as it's done carefully, going to surgery it doesn't mean it's going to be 100% safe, but you have to trust the process. You have to trust the surgeon. You have to feel like you're engaged in that process. And you have to be real with your experience. And so every time I prescribe something, I tell them, I'm here with you. We're on this
Right.
journey together. Tell me how you feel. Everyone has their own unique body and genetics that may cause you to have a different experience with the medication, right?
Yeah.
You can take this medication, Taylor, and then have a complete experience than me taking this medication. That doesn't mean that medication is bad. It just means that your body responded to it this way. You also have to consider what else are you taking with the medication? Are you drinking every day? Are you hitting that, you know what I mean, like your own herbal products? You eating dirt with it? Like, what are you doing with your medication? How are you taking it? When are you taking it? And those honest conversations is what allows you to have the most positive experience. And so just understand it's very much evaluated and trusted. My job is to help you just get better with whatever means that we can get through as safe as possible. And we're here with you on the journey. A good provider is going to be available to help you out and adjust where we need to. But it's been trusted and proven over years. They are not perfect. So do not feel like medications are, 100% the way for everyone. They're not perfect, but they have truly profound effects that has saved so many people's lives. And so
Mm.
I urge people to really, evaluate if you need it, please proceed with that. It could be a life or death decision for some
Yeah.
people.
Yeah.
I have a quick question. What if
Mhm.
you can talk about it, what from your experience, what are the main fears that people have when it comes to taking medication?
Weight gain, that's a big one.
Hmm.
Nah, but a
Mine's
lot of
helping
it
lose weight.
that's good. That's good. Yes, yes. So it's funny, but serious though. Like a lot of folks, the first thing they say is weight gain. But I think really though that the more pressing or concern that I would hear is I don't want it to change me. I don't want it
Mm.
to, make me a zombie, or I don't want to get hooked on it. All very valid concerns, and these are things you should bring up. Like I said, I ask my patients, like, "What do you give me all the fears, all the concerns, right? And let me clear up the misconceptions." People read a lot of things online. You go on a Reddit, a forum. Oh, I took gabapentin and my head exploded. I'm like, well, you are also, doing fentanyl on the side. Like your experience is not the same as this person's experience, and so it's important to individualize. But you hear a lot of, "I don't want it to change me." And medications are not supposed to change you. Let me put it this way. Mental health medications aren't supposed to zombie you out or blunt your emotions. They're not. If that's happening, then it's not working in the right way. We have to adjust or switch to something else. But it's intended. The main impact is intended to help you better operate, better manage stress, help you to better navigate a tough, stressful moment, stressful life,
Yeah.
stressful situations, because the mental health condition is kind of sort of adding extra layers to you that prevents you from being your optimal self. So the medications, if anything, is just helping you to better operate. And it shouldn't change you for the worse. It shouldn't be compromising your personality. It should only enhance and give you sort of tools to better work through your day to day. But all those concerns are very real, and it can happen with certain medications, with a certain individual, with your certain genetics. But that doesn't mean it's going to happen to everybody. They're all very manageable.
Yeah. So I'm going to share a little background on my medication history. I'm going to start with my grandmother, though. My grandmother was was a part of the 1950s and 60s housewives who were prescribed medication to, uppers and sedatives to just, get them going because they're stuck at home all day watching kids and cleaning the house. And she got addicted to the medication. We know that a lot of medication given in the 20th century and prior to that wasn't always healthy, was addictive and, opioids and all that. So I just want to just like name that like that is part of the history where like women were being overprescribed and misprescribed and it was damaging. But for me today, starting I think it's like 2020 is when I got prescribed sertraline. But when I was getting prescribed to that, I was like, yes, I'm depressed. Yes, I have anxiety. But there's something else going on too. And like, I want to get checked out for that. And I would not forget the lady just staring at me looking pathetic, like, move on, girl, and just take the medication. And so I did. Sertraline was helpful for me because it just kind of like, I'm good. You're not going to get me too down. I'm good. But it wasn't rocking my world in like a beautiful way. So fast forward to December, where I was like, I have to get this brain going so I can do what I need to do with my life. Like, so I can manifest all the things I have a vision for. So that's why I'm like, let me just try to get diagnosed with ADHD because at the least I will get some medication that'll get me going. So I was diagnosed with it. I tried Adderall at first. I did like Adderall. And then I want to stop right there real quick because I know that people abuse Adderall. And so what I've realized is that there's a distinction to where, like for me, literally Adderall is just turning my brain on and like getting me working. It is not that fun for me. It is not like turn up party. And I think that people who like where it is where you have this adverse effect to where you want to abuse and turn up, I think they're probably not neurodivergent in taking that
Hmm.
medication,
Right.
So I just wanna name
Hmm.
that, like, when it comes to stimulants, it works for people's brains who needs the stimulants. If you
Hmm.
Mhm.
don't need stimulants, then it's gonna have an adverse effect on you. So I'm on Vyvanse and Wellbutrin. I love you Wellbutrin. That's helps increase your dopamine. Prior to that, I was on sertraline. And as you mentioned early, it was because my serotonin was low. So it gives you a serotonin boost.
Mhm.
but I'm not taking that anymore. I think the dopamine piece of the Wellbutrin has been gorgeous for me.
Mhm.
I have a friend in particular who has dealt with a lot of depression, and I recently had a talk with her. I'm like, "Hey girl, you might want to check it out because at the least it'll just make you feel better and it'll just get you going and out of this dump you're in." And she's like, "I hear you, but respectfully, my mom has been on antidepressants my whole life, and I can tell the difference when she doesn't take it. Like, she's high one day and she's low when she doesn't take it." And I'm like, "Well, what kind of antidepressant is that?" Because how I understand it, it takes 2 weeks for it to even start working for you. And then you just got to take it every day. But there is, like, if I miss a day, there is no up and down for me. I just, let me take it again. Like, so all of that being said, I kind of want you to break down the categories of medication and how do you figure out what to give a person, and just kind of like, especially for our audience, just help people understand what's right for them, what might not be right for them, and just how all of this works when it comes to antidepressants and mood stabilizers.
Yeah. First of all, thank you for your vulnerability and sharing your journey. That's not something people talk about enough. We do need to talk about and share these journeys with our medications and what we're experiencing. So there are a lot of different categories, like you
Yeah.
mentioned. And I've been on sertraline myself, and I had a great experience on it. I switched to escitalopram, just Lexapro for a while, and that was also good. And then bupropion for a little bit. For
Yeah.
those who are trying to lose weight, that's one of those meds that can
20
actually.
pounds, y'all. Well, actually, low key 25 pounds I've lost so far. Low key, I'm just saying.
So a lot of different categories, right? We kind of look at kind of approach it based off of the condition you're treating. And that's kind of how the medications are named. Antidepressants, for example, that's where you see your classical Zoloft, the Lexapro, fluoxetine, also known as Prozac. And then you have things like venlafaxine and Cymbalta, all those stuff. So though they're named antidepressants, they also can be used to treat different conditions, including anxiety and PTSD, and various other little conditions, even premenstrual dysphoric disorder (PMDD). So various conditions, even though it's considered antidepressant, right? So you'll see a doctor prescribe you something. That's very important too, because a patient will get something like, "I don't have depression. I just have this." Like, it's okay. The chemicals that are, affected are pretty similar, right? And you'll see that in depression, one of the main chemicals, like I mentioned earlier, serotonin. And so antidepressants, they target that, they try to boost that. In anxiety, serotonin is low as well. So they prescribe antidepressants. In PTSD, tends to be low as well. So antidepressants. And then you have antipsychotics, and even that, right? So examples of that would be Abilify, Cablita is the new one. There's also some older ones like Risperidol and Clozapine, Haldol. So those names, those are all antipsychotics. And for them, they are used to mainly treat schizophrenia conditions, psychosis, right? Anything that's associated with hallucinations, delusions, right? And that's a whole discussion that we can have about how delusions is way more prevalent than we think. But
Mm.
any aspect of your mind that feels altered, right? The way I like to describe it to my patients is that, because I don't want to demonize them or kind of sort of ostracize their mindset, right? I want them to feel like, hey, it's okay. I don't think that you're off. I don't think that there's anything wrong with you as a person. It's just mentally you're not probably processing things in the safest way. And there are times where in schizophrenia, what we call poor insight, where you don't recognize that you're going through this. If somebody, say, for example, has a really heavy delusion, I have a patient that believes that Mayor DC is in love with him. And so he's sending her chocolates and flowers, and he has a police order against all this stuff. And for him, he doesn't think anything's wrong with him. And antipsychotics, their role is to lower the dopamine levels because dopamine tends to be high in schizophrenia and psychosis. And dopamine is a chemical that tells us this is important. This is important. Also tells us feel rewarded, feel happy. It also tells us how to move our muscles in a certain way. It has so many different functions. And so when we look at the medications, like an antipsychotic, it's targeting dopamine that's too high that causes us to see things that aren't there or believe things that aren't actually happening.
Mm,
Because when dopamine is high, it's telling you to make connections to things that's not real. That's where
mhm.
delusions are. It's saying this is important, this is important, this is important. So connect all of that. And then you start to create a reality that's not there. So the antipsychotics are helping to reduce the dopamine. And what I noticed with my patients, once it starts to work, they're like, yeah, for example, like the Mary Boss was like, yeah, I don't know. I don't know why I was thinking that. Yeah, no, I'm good. No, she's not. She's the mayor. Why would she be in love with me?
That I love, well, just love that there is a way that we can course that. So, yeah.
Yeah,
Yes, yes. It's a very, very livable condition for sure, but it just has to be managed.
yeah. You saying that reminded me of the story of the man that proposed to Kiki Palmer at a South by Southwest event. So I wonder if there's
I'm not
something
hip.
going on there.
Oh, well, see, this is the thing.
There's a
There's
lot
a
of
lot of
delusions. Yeah.
delusional disorder out here. A lot of people with schizophrenia that people don't realize, and schizophrenia is not always just people. I think have the cultural perception of it as somebody who just like, oh my god, what's that? Like catching birds, and that's not always what it is. I have a lot of patients come to my office who look like they are completely kind of just all together, right? But they start talking. You give them like probably 5 minutes. Oh yeah, brother. We gotta get you on some antipsychotics. Like you're wilding. And so it's very it comes in various spectrums and it can look like a sort of a very normal thing, but I have a patient with a couple, the husband pers- uh, persistently thinks that she's cheating, right? Every little thing that she's doing and so forth. Antipsychotics, he calmed down, relax. And I'm talking about like this is not just a think she's cheating, like, and I saw some messages. It'd be like she goes to her room for a rest. He's like, oh yeah, she's probably like calling her dude or whatever. It's like, no, she's snapping. But delusional disorder, remember, like I said, dopamine makes you put connections to certain things. Too much dopamine makes you connect certain things that aren't there. And so when he
Mm,
started taking an antipsychotic, he was able to better regulate his thoughts and use more of his prefrontal cortex, which is the logic center, and not jump to certain conclusions or make connections that aren't there and having a happy, marriage now. So, anyways, antipsychotics. They could also be used for bipolar disorder as well, helping to control the mania. They also could be used to help assist with depression that is hard to treat. So again, the label antipsychotic doesn't mean you have to have psychosis to use it. It could be used for so many different things.
mm,
And then you have a few other kind of categories, anxiety meds. Some of the ones, the benzos, I tell people to avoid. That's all the ones you hear in the rap songs, Klonopin, Xanax, Xanny bars, all that. Avoid them unless it's like your provider says it's a true emergency. And to me, honestly, this is one of those medication categories where I'm like, oh, we don't really need this. Like, unless it's like usually in surgical or sorry, ICU situations or extreme emergency situations. But on a conventional kind of day to day, if you're ambulatory, if you're able to walk and go about your day to day, you should not be on the benzodiazepine, the Xanax, and all that stuff. There's too many other options to help manage your anxiety than being put on that. Essentially, what that is almost like it hits a certain part of your brain that is similar to where alcohol hits. So it's like almost like taking a shot in a way with like a heavy OD shot that just tranquilizes you, but it doesn't solve the problem at all in the long run. And it
mm.
makes you addicted to it, where you feel like you need it in order to continue to feel that good. So it's one of those meds I try to avoid as much as possible, but it is a category as well. So yeah, those are some of the main ones out there.
I feel like beta blockers are coming up a lot as a
They
way.
are.
I know like a lot of women celebrities use it when they're gonna like have to be on stage and give a speech.
Yes.
So that is something that's helping with at the least social anxiety. Is
Mhm.
that a replacement for benzos or what is that about? Like what can maybe walk us through what beta blockers are?
Yeah, and it's hard to say what's a replacement for benzos. 'Cause benzos are
Yeah.
very powerful, but I would say these are different options, safer options to try for situational
Mm-hmm.
anxiety. So
Mm,
propranolol is one that is a beta blocker. Inderol is the other name for it that people have often been used or using to help with performance anxiety. Beta blockers, those aren't psychotic or mental health medications by kind of its conventional indications. They're used for blood pressure, heart conditions, and so forth. But what happens in anxiety is there's a lot of your body's response to anxiety, right? What we call
Mhm.
somatic response. So when you're anxious, I'm sure you feel that stomach feeling, your
Mhm.
heart is beating, sweating, shortness of breath, depending on the individual. But beta blockers, they kind of have this impact on calming your body, you reducing your heart rate. And part of that is telling your brain that, oh, it's okay. It's
Mm.
okay. And I don't have to be as anxious. It's all right. Some people get more anxious because they feel anxious. So their heart is beating and they're like, oh, something's wrong. You know what I mean? And so I'm even more anxious. You doing a presentation, you start sweating, you get even more anxious. You start like, "Are these? Can they see how much I'm sweating? Like, something bad's about to go wrong," and your brain kind of perpetuates that. Our
Mhm.
brains. I'll tell you one thing, controversial, but our brains are they they're stupid.
I knew
Our,
you
our
was
brains,
gonna say that. What? We're dummies?
yo,
Okay.
You're
our
so
brains are
conflicted.
not the best in like. It's very primitive, right? And we have to, and let me put it this way, certain parts of our brains are very primitive, and sometimes they take over. The primitive part of our brain takes over. They're kind of like, oh, what's going on? There's a fire. Set the alarms. And you're like, bro, relax. You know what I mean? And if we don't regulate those thoughts, we push ourselves into certain conditions that shouldn't be there. I always say, don't believe your thoughts. Don't believe your initial thoughts. Always question your thoughts. All right.
Mhm.
When something pops up, people tend to think, this must be like how I truly feel. Like if I thought about it, then that is truly it. Like, no, your brain is thinking about a lot of times the worst case scenario. And it's up to us to diffuse that and look at all perspectives. So we have to be very mindful of the fact that some of the systems in our body are kind of done to protect us. It's a survival mechanism, but sometimes they're turned on too much or they're turned on too high and it's in the driver's seat. And once we do that, we lead ourselves into certain states, conditions, and situations that is hard to kind of get out of. So, anyways, beta blockers. That's that's what
You're
they do. They
saving
kind of
lives
like,
right now. I just wanna name that. I feel like you're saving a lot of lives right now with all the
thank
various
you,
things you're sharing with us, so thank you.
thank you, thank you, thank you,
Absolutely.
thank you.
So you recently launched this mental health app called Mental Keys. What was the gap you were trying to close with creating it, and who did you make the app for specifically?
So, mental keys is kind of almost the antithesis of what I do. It has really little to do with medications. I created it because I recognize that a lot of the patients that I get, a lot of folks who come to my office, they're usually coming in crisis, right? They're coming at the point where things are crumbling. It's like, fine, I need help. And I kind of look at it, right, and reflect back and say, okay, well, how do we get here? A lot of the things that we can do to prevent our mental health, we are not engaging in. To prevent mental health conditions, we're not engaging in. So I built that app, Mental Keys, to develop healthy habits that allows individuals to strengthen their mind, develop resilience. And when I say resilience, I mean essentially being able to create habits that allows you to withstand tough moments, stressful situations, life in general. By being able to curate those habits, we're better prepared for situations that come about that almost feels like the end of the world. I talked about earlier how there are situations where our brain is telling us like, well, set the alarm, set the alarm. Building healthy habits and creating resilience can help to tune that alarm and discern whether this is a true alarm or I can shut this off. How do I regulate my thoughts? Part of that is your habits. Sometimes it's hard to regulate your thoughts when you're in a state of panic and you haven't slept well, your body's deprived, your cortisol levels are high. You can regulate those thoughts, in moments like that as well. So people come to my office in crisis. I felt like, let's do things before we get here. And even when we do get here, how do we cultivate a healthy lifestyle that ensures our brain is prepared and ready and able to better manage the conditions that we're dealing with? So Mental Keys is all about that, right? It's healthy habits, including exercise, your diet, a sleep structure, your community engagement, spirituality.
Wow.
your connections with loved ones. It personalizes where you are and how you manage your life in those aspects. It gives you a score, and then it uses programming to personalize how to go about improving those areas. So you would imagine someone who has no encounter with a mental health provider, but they know that, hey, I don't be feeling my best all the time. Tap in. Tap in, check out where you are, where's your mental health score at, and it guides you through that process of just building healthy habits. I put in different elements to help improve that, including gains that improve cognitive functioning, memory, reducing anxiety. I also put in different homework tasks. I have a community section there where you can share, your stories, your journey with other
Wow.
people. They can react and interact with each other. I have a resource hub where it links to various help out there,
Mhm.
therapists and rehab centers and so forth, and learning opportunities, modules that goes through like, this is what this condition really is, not whatever you heard on that podcast. We love podcasts though. This one's
Yeah.
fire. But this is the real information, up to date. And it guides and tracks your progress. I also have this tool where you're able to identify how food affects your brain. So you can scan your food and it gives you a report like that beef and cheese sandwich you ate is cooking your brain, brother. So put that
And
down.
it will.
It
It
would,
will.
it
It
would
will
tell you
smack
what it's
you in the
doing.
face, okay?
Well,
Yeah.
Taylor is oh, go ahead, my bad.
No, 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 no. Go ahead. Yeah,
Yeah,
go ahead.
Taylor's been utilizing the tool this week, so why don't you share, what your experience has been like?
Yes, child. So this is a perfect segue into the next question. But I thus far love the app. So I have access to it right now. But what I love about it is when I've been wanting to get more into writing what I'm grateful for, and it has like an option for you to do that. It has an option for you to do like self reflections as part of your journal. So you can also journal like your fitness. I haven't really been working out like that, so I can't
Can't
really
speak
speak
to
to it.
that.
I did. There's a nutrition part, so the brain nutrition. And what I love about the app is that throughout it, it gives you just some facts about certain things. So it gives you facts about like nutrition or food and how like your food serves your brain and how it doesn't. And then I especially love like the brain gym exercises. So he has like some breathing bubbles. So a grounding moment, right? To breathe. The mind merge, which is my favorite, which is matching the tiles. It puts me just in a different headspace. There's word unscramble. What I do love though is the thought zapper and then the purpose finder as well too. So I am very curious to know, Dr. B, you put in all this work and all these things, but as you know, I would like to say we're a mental health adjacent podcast. What do you think, or what does purpose have to do with mental health, do you think?
Hmm.
And why did
Mm,
you decide for that to be a part of your offering?
I love that. I love that. I love that. I love that. So purpose kind of this ties back to that moment in my life where I didn't know who I was, right? And that was playing a huge part of my mental distress, honestly. Purpose helps to align and realign you no matter where you are, right? Whether you're dealing with a stressful situation, you're concerned about what the world, how the world's viewing you and what the pressures the world is putting on you, the one thing that you can go to is who you are. And part of knowing who you are is identifying your purpose. I think that also brings you closer, if you're spiritual, to God.
Mhm.
Identifying your purpose is identifying why you're here. Why did God put you on this earth? And that process allows you to better understand your creator. But outside of just a spiritual perception of it, just chemically and clinically, there's studies that indicate those who pursue the journey of purpose finding tend to live longer. It's
Come on.
also associated with reduced anxiety and depressive symptoms. Bunch of studies out there. I can send you, but it's profound because it does kind of align you in stressful situations as much as possible. If I know that this is not for me, I'm not distressed when it doesn't happen, right?
Mhm.
If I
Mhm.
pursue something and that door closes, I can look back and reflect on myself like, that's not in alignment with me. So I don't have to be depressed. I'm fine. My purpose will come. My purpose is through here. My purpose is through there. So self identity can help you to feel more grounded. It helps to prevent you being too shaken by outside noise. We go on social media and you see so many different things, so many different sort of identities, and you try to almost identify yourself through that. If you don't know who you are, you get shaken, and you come off of Instagram and like, what's my life? What is life? What am I doing in my life? And the absence of purpose and self identity can lead to some of those stressful situations. So it's a very profound opportunity to ground yourself, know who you are, and honestly, stave off all these sort of outside noise that can lead to depression, anxiety, and various mental health conditions.
You literally just that is why I created Become Your Own Muse, my coaching business. Like, that
I
is
love
the
that.
framework, that is the why. You just absolutely named it. I might share my framework with you just to get your feedback, but
Sure.
amen. That's it. I hope people caught it. Self-identity, purpose. Let's work through that so we can be happy and thrive and give back to our community through our purpose in that way. So,
Absolutely.
this is
Absolutely.
how can people find this app? Because it's so cool.
Thank you. Yeah, so I'm actually it's awesome when you all reached out to me when Taylor said, "Hey, you want to get on this podcast?" I was really at the initial stage of launching the app, or at least kind of presenting or introducing it to the public. So right now it's available as a mobile web app on mymentalkeys.com. So you go on your phone, go to their site, you get early access to when we finally drop it on the App Store and become a full app. So going to our site allows you to access it for free right now. It'll be a subscription later, but it's free, and you can kind of get a chance to play around with it, create a profile, personalize your mental health journey. And I also want to say too, this is one, I purposely built it for us, our community. I have a lot of themes in there that you could probably tell that it's culturally representative of Black people, because honestly, I don't think we have too many spaces, enough spaces for us to feel comfortable and navigate this mental health journey. And I did a lot of culturally sensitive or responsible nuggets in there. So the way the questions are asked, there are things within our conventional mental health psychiatric treatment that over the years, they were angled from the perspective of white male or white female. Not a lot of cultural references or relevance that sometimes misses our community, right? Even some of the questions that they ask in these conventional assessments, they don't take in consideration how we operate or how we perceive things. So we may answer it in a certain way that may not be as accurate. I designed my assessment and the app to capture all of that. So it's very inclusive of us. It's for us, by us, for us. And I'm excited for, our community to continue to delve into it. So mymentalkeys.com.
Yes, thank you
Check
for
it out,
sharing
y'all.
that. Okay, one more question, but first, I also just want to name my gratitude for the fact that you work with veterans at the VA. I think that is really important. I'm really glad, again, to know that we have a lot of Black soldiers who have served, and to know that there are opportunities for them to face another Black man as they talk through their experience and what they might need when it comes to I knew I was going to say it wrong. I was going to say PSTD. That's not right?
PTSD.
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 Yeah,
I have dyslexia.
you're good. You're good.
So, yes, I just want to thank you for doing that work. And I'm grateful to know that there is someone who is supporting them in that way. But my
Absolutely.
question is, on that note, for someone who is having a consultation with you, what can they expect to walk away from that consultation? And yeah, that's the question. If I'm having a consultation with you, what would it look like, and what can I expect to walk away from it?
Yeah. So it's going to be a lot of peace, right? It's peace within the journey, peace that it will be okay, peace that we will eventually get to the space or the version of you that you desire to be. I always tell people, like, this visit is not gonna solve all your problems. It's not gonna automatically get rid of the stressful situations or the things that you're enduring in your life, but it can at least unlock some kind of peace knowing that there's hope, that I can get better. PTSD is not defining my life. That my condition is the ultimate demise of, my future. I love whenever I hear, hey, you know, I'm ready for this journey and things will be okay. I'll be fine. There's this sense of almost temporary, like maybe this will be okay. Now, granted, it'd be a week later. It's like I'm crashing down. This is like this sucks and everything. But it's like it's okay.
Yeah.
Mental health is a journey. It's not a destination. I tell people
Mm-hmm.
all the time. It's more about how you navigate that journey versus I finally got here and that's it. So when people come in my office and we have our initial visit, I'm like, I want to know you, I want to understand you, and I want you to feel comfortable knowing that I'm here with you. And this will be a bumpy ride. It takes work, but you will get to where you want to get to. And as long as you trust me, I'm willing to help you as much as possible. So yeah,
Amen.
Shout out to you
Shout out
doing
to
the
you.
Lord's work.
Thank you, Mr.
amen,
B. That's good,
amen,
Mr. B. Dr. B.
amen, amen. Look, man, look, y'all
The doctor,
can't play. I got him right
you're
here,
right.
so
Don't play. Don't play.
Yes. And from the Howard
B.
University.
Oh, okay. I know we were doing
ain't
that.
you?
You
You
know,
know.
Xavier, we have the most Black people to med school, okay? So I got to give a shout out to my HBCU,
Shout out.
XU.
Shout out
Thank you.
HBCU.
Shout
Shout out
out. Shout
HBCU.
out. All right. So before we close, we like to do some rapid questions. So are you ready?
Yes, yes.
So
Okay.
excited for this.
I know. Okay. What is one thing people get completely wrong about mental health medication?
Rapid.
It will destroy my body as soon as I put it in it.
Great.
Put it in my body.
Okay. A phrase you wish we would retire
Ooh.
from the Black community as it relates to mental health.
Gaslight. Yeah, using it wrong.
I agree.
The best thing someone ever said to you that changed how you saw mental health.
I can see you.
So good.
They were
Okay.
able to remove my mask. Like I can see you.
That's a good one. If someone downloaded the Mental Keys app tonight, what's the first thing you want them to do?
Um, put it in focus mode. Put it in focus mode and check out all the issues that you have and actually like hit that. Like get into it. No. Take the assessment and, humbly walk into it as a journey for you, not for anybody else, but just for you. So just start with the assessment and then go from there.
Okay. Last one. What do you do when your cup gets low?
Work out, exercise. Exercise has been a very awesome kind of therapy for me.
Yeah.
And it's counterintuitive because you would think cup is low, you got to rest. But it actually fulfills me. It gives me energy, reflect, and recenters. So exercise has been for me.
What is your exercise practice of choice?
It used to be basketball. Tore my knee up. But right now, any kind of weightlifting or biking is kind of what I go to.
I like that. Is it the
All right.
endorphins? You getting the endorphins running and I just
There you go.
Yeah.
The endorphins. I've had like Saturdays where I'll go in the gym for like 3-4 hours by myself and get creative. Listen to podcasts, pray, meditate, and just it's like a spa for me. Like
Yeah.
it's really therapeutic.
Choice.
I actually did a lot of development of the app in the gym. So it's
What gym you at? You got an office at the gym or something? Got like a little private room you go to? What gym is this?
no, this is LA Fitness. It's your
Okay.
regular old LA
You
Fitness.
conceptualizing it. There you go.
Yeah, exactly. You create the space that you're in. You could be anywhere. You could be in
Yeah.
paradise anywhere. So yeah.
True. That's true.
Facts on facts. Well, Dr. B, we thank you for your time and your wisdom. You have just been such a gem. Please tell our dreamers where to find you and how to work with you and how to support what you're building.
Yes. Social media outlets is probably the most visibly present way you can find me or see me at yourmind.artbusiness. And then at my mental keys to kind of explore that journey with the app I discussed earlier. Also, I mean, no, don't email me. I was about to say email me. Don't email me. No, don't. Just DM me if you if you're trying to connect. Just DM me. I'm on LinkedIn as well, but I barely be checking the DMs on LinkedIn. So yeah, probably like Instagram is the easiest way to reach me.
Okay. Well, you
Think
heard him,
about
folks.
is someone who's
Yeah,
gonna start
yeah,
emailing you every day, like, "You're my doctor. I know you're my doctor,"
yeah.
and then you gotta prescribe them on
Nah,
the
nah. Drag to trash. Recycling bin. Dragging all that to trash.
Oh my god. Thank you
Oh
so
my
much.
god.
We're gonna let you go on with your day, but
Absolutely.
we really appreciate the time that you gave us and all the wisdom and, information, insights that you dropped with us, so I'll
Yes.
follow
Thank
you
you.
on
Thank you.
Instagram.
Check out
Yes,
mymentalkeys.com. It is very
yes,
helpful.
yes. Tap in, y'all. Now I'm blessed to be here. I love this platform. I love the conversation. This felt amazing. Thank y'all for making me take off this part of my Friday.
We're happy to.
I love it. I love it. Let's do this more often. Now this is
Aw.
great.
Come on back. You'll be
Y'all
our
check out
resident
this app.
doctor.
Y'all check out this podcast. Y'all tap in. They're doing amazing things over here. So
That's
I
so
love it.
Thank
nice.
you.
Appreciate
Thank
y'all.
you.
Absolutely.
Appreciate
Absolutely.
you.
Thank you.
All right. Enjoy the rest of your Friday.
All right. Y'all too. Y'all take care. Be blessed.
Thank you.
You too.
What a nice man.
He-
Is he single,
he-
Taylor, for our audience, not for us, for our audience?
I don't know.
I
I
can't believe
don't
I didn't
know.
ask
I
him. I
I did
can't believe
not inquire.
I had all the time. I had an hour and 30 minutes and I didn't ask him. But anyways, I'm asking for you guys, not for me. I'm asking for y'all. Um,
You are silly. Uh, all right, y'all. I hope that y'all enjoyed that fruitful conversation because I know I did. I learned a lot and I hope y'all did too. But let's move on to our Be Well RX segment, your dose of upliftment to carry you throughout the week. I don't know where that performance came
wow.
from, but
Okay.
it's giving season finale energy.
I came up with
All right.
choreography and everything. Go ahead.
Yeah. Okay. So these are your affirmations for today's conversation. First, my mental health is not a weakness. It is worthy of the same care I give everything else. Period.
Period.
Second one is asking for help is not giving up. It is choosing myself. And the last one is healing is not a straight line. Dr. B just talked about that. And I give myself grace for every step of the process. All right, y'all. So repeat those things out loud or internally to yourself. Write them down, but let them take root so that you can start to believe it.
Man, amen. And our journal prop for this week is, what stories have I been carrying about mental health that might be keeping me from taking care of my mind? And what's one thing I am willing to do differently? Sit with that, see what comes up for you. And, if there's some things that you have to like finally accept that you weren't willing to prior to this conversation and journaling, that's okay. The work begins now, and we're happy to chat with you guys and support you guys if things come up for you in that way. You are worth it. You are worth investing in yourself. So yes. So, in general, if this conversation or this episode has moved you in some way, send it to someone else who you think might need it. I feel like I can share this episode with my mom. I think she'll find it very intriguing. Drop it in the group chat or just put it on your timeline. I think that this is a conversation that definitely needs to be heard in our community, and I'm glad that we've been able to provide it. So, share it so people can hear it and see it.
Yes, absolutely. And then let us know what landed or what shifted within you, A lot of things shifted within me. So, we want to hear that too, okay? But don't forget to follow us and find us on Instagram at Muse and Be Well, on TikTok as well. subscribe to our YouTube channel so that you can just stay in the loop of the things that we are putting out, okay? Because we are trying to make sure that you live well in your mind so that you can go out and exude and what else am I trying to say? And just live your life with purpose, in purpose for what God has destined upon you, okay?
Amen.
Okay. We're just two gals that are just trying to do the work, show the work, and help to provide you with the tools and resources that you may need so that you can get over that hump, so that you can live your life and be well. So you can muse and be well. Okay. And to become your own muse. Okay.
All of that, all of that. Thank you guys. Thank you, Taylor, for a great season. Thank you to our listeners and our watchers who are new here, who have come and watched every episode, who has liked our things on social media, who's followed us on social media, who has also just shared with us one-off, like, I'm enjoying this platform. Thank you all so much for your support. I'm going to miss you guys, but you can listen to me whenever you want now. You won't miss me too much, probably. But this has been Muse and Be Well, where we remind you to trust yourself, stay grounded, and be well. Take care.
Bye, y'all.
Enjoy your summer.
Yes.